Hello and welcome. Today we're shedding light on a rare but significant eye condition affecting infants, congenital glaucoma. This is a condition that can rob children of their sight if left untreated, so understanding it is crucial. Congenital glaucoma isn't typically caused by external factors. Instead, it's almost always due to developmental abnormalities in the eye's drainage system. Specifically, these abnormalities prevent the proper outflow of aqueous humor, the clear fluid that circulates inside the front portion of the eye. Genetic factors play a major role, with mutations in certain genes, such as CYP1B1, being frequently implicated. In some cases, congenital glaucoma can be associated with other systemic conditions, although this is less common. To understand congenital glaucoma, we need to understand the eye's pressure. Aqueous humor nourishes the eye and maintains its shape. It's produced and drained at a steady rate. In a healthy eye, this production and drainage are balanced. However, in congenital glaucoma, the abnormal drainage system, specifically the trabecular meshwork and Schlemm's canal, obstructs the outflow. This blockage causes the aqueous humor to build up, increasing the intraocular pressure, or IOP, inside the eye. This elevated pressure damages the delicate optic nerve, the cable that transmits visual information from the eye to the brain. Over time, this damage leads to progressive vision loss, and if untreated, can result in blindness. Congenital glaucoma is a relatively rare condition, estimated to affect approximately 1 in 10,000 newborns worldwide. The incidence can vary across different populations, with some regions showing a higher prevalence due to genetic factors and consanguinity, or marriage between close relatives. Although rare, early detection and intervention are vital to preserving vision, making awareness and screening efforts crucial. The signs and symptoms of congenital glaucoma often become apparent in the first few months of life, though they can sometimes appear later in infancy or early childhood. Key signs include excessive tearing, also known as epiphora, light sensitivity, or photophobia, causing the baby to squint or close their eyes in bright light, and blepharospasm, which is involuntary squeezing of the eyelids. The cornea, the clear front part of the eye, may appear cloudy or enlarged, a condition known as buphthalmos, or ox eye, due to the stretching caused by high pressure. The infant may also exhibit irritability, poor feeding, or generally seem uncomfortable. Recognizing these signs early is crucial for timely diagnosis and treatment. Diagnosing congenital glaucoma involves a comprehensive eye examination, typically performed by a pediatric ophthalmologist. The examination includes measuring the intraocular pressure, or IOP, using techniques suitable for infants, often requiring sedation or anesthesia. A thorough evaluation of the cornea and optic nerve is conducted to assess for signs of damage. Gonioscopy, a procedure that allows the ophthalmologist to visualize the drainage angle, the area where aqueous humor drains from the eye, is crucial for identifying any developmental abnormalities. Additional tests, such as ultrasound or optical coherence tomography or OCT, may be used to further evaluate the eye's structures and assess the extent of optic nerve damage. A detailed family history is also important, as genetic factors often play a significant role. Congenital glaucoma can be classified into several types, primarily based on the age of onset and the underlying cause. Primary congenital glaucoma, or PCG, is the most common type and occurs in isolation, without any other associated systemic conditions. Secondary congenital glaucoma occurs in association with other eye abnormalities or systemic syndromes, such as Sturge-Weber syndrome or neurofibromatosis. Infantile glaucoma refers to glaucoma diagnosed between 3 months and 3 years of age. Understanding the specific type of congenital glaucoma is important for determining the most appropriate treatment strategy. The primary goal of treatment for congenital glaucoma is to lower the intraocular pressure and prevent further damage to the optic nerve. Surgery is typically the first-line treatment. Common surgical procedures include goniotomy, which involves making an incision in the drainage angle to improve aqueous outflow, and trabeculotomy, which creates a channel to bypass the obstructed drainage system. In some cases, glaucoma drainage devices, such as tubes or shunts, may be implanted to facilitate drainage. Medical management with eye drops to lower the IOP may be used as an adjunct to surgery, or when surgery is not immediately feasible. Lifelong follow-up is essential to monitor the IOP and optic nerve health. Unfortunately, congenital glaucoma can't be prevented in most cases, as it is typically due to genetic factors or developmental abnormalities that occur during pregnancy. Genetic counseling may be beneficial for families with a history of congenital glaucoma to understand the risk of recurrence in future pregnancies. However, prompt diagnosis and treatment are key to preserving vision. Early detection through newborn screening programs and awareness among parents and healthcare providers can significantly improve outcomes. The prognosis for congenital glaucoma varies depending on the severity of the condition, the age at diagnosis, and the effectiveness of treatment. With early diagnosis and appropriate surgical intervention, many children with congenital glaucoma can maintain useful vision throughout their lives. However, some children may experience progressive vision loss despite treatment, requiring ongoing monitoring and management. Recent research focuses on identifying the genetic mutations that cause congenital glaucoma to allow for earlier and more targeted interventions. Gene therapy and other novel therapies are also being explored as potential future treatments.